message is repeal and replace the Affordable Care Act, but there's absolutely no plan for how to do that. As you pointed out in your news commentary, the president keeps promising a, quote, tremendous plan, but there is none. The only thing that he has actually said was that there would be protection for people with pre-existing conditions, and all insurers would be forced to accept them. The problem is that's already the law of the land. That is what the Affordable Care Act says. So the only conclusion I guess one could make is that this is trying to promise the American people that if the Supreme Court case is won by the Trump administration and the Affordable Care Act goes away, that somehow magically pre-existing conditions would be covered. It's a dilemma.
And certainly one that's taking a long time. And as we know, Trump also highlighted how the country was faring before the coronavirus. But how has the lack of a cohesive national plan versus these individual states taking action, how has that impacted the national healthcare systems as well as costs?
Well, it certainly has impacted it, of course. As you know, because of the pandemic, hospitals had to take care of the critically ill corona patients. So elective surgeries across the country were canceled. Hospitals have estimated that they're losing over $200 billion this year. Doctors' offices closed. Obviously, it wasn't felt to be safe to be open. So the costs are astronomical. But the real costs are in lives lost. I think that should be remembered. And so we're up to nearly 178,000 Americans who've lost their lives, and it isn't stopping. It's about 1,000 people who die per day. That cost should never be forgotten.
Absolutely. And we know that obviously we hear a lot of talk about the availability of PPE, but where do things actually stand with not just the availability, but the accessibility of PPE?
Well, most hospitals are okay with PPE right now. At least in New York, where I am, where we were hit the hardest in the beginning, we're doing fine. But where it is flaring in other parts of the country, you will hear isolated hospitals, particularly rural hospitals, and in some cases large urban hospitals, that are really struggling to have the appropriate protective equipment. Frankly, it's a maldistribution, and there's no national plan for distribution. Most places have tried to figure out ways to do end runs around that and get what they need, however.
Now, I also want to ask for your outlook in terms of viable treatments and what people should be aware of in this rush to get these to market.
Well, one has to be very careful because treatments of any sort should not be a political football at all. And you saw over the weekend the president tweeted that there was a deep state, whatever that is intended to be, at the FDA that was discouraging people from volunteering for the studies on therapeutics and vaccines, and that they were doing it deliberately because they wanted to wait till after the election. That's simply preposterous. The FDA is comprised of career scientists, and the FDA commissioner himself, who is a political appointee, has clearly said that there will not be a rush. This will be evaluated scientifically.
Now, just quickly, there are a lot of things to consider, not just prices, but also advances when it comes to telehealth. What should we be on the lookout for in that regard?
Well, telehealth has exploded. And frankly, this is going to be a sea change in the way care is delivered from here on in. There's no question about it. Patients like the convenience. Doctors who were slow to adopt it because they weren't being paid adequately are now, at least through the pandemic, the end of the pandemic, will be paid adequately. And so it's here to stay, and it's definitely been a technology that has been helpful to people on both ends of either the telephone or the Zoom or the Skype call. Many things can be done that way, and patients like the convenience, and doctors are adapting to it. It's interesting that large businesses 80% of them say they fully expect telehealth to be part of what's happening in the healthcare of the future.
Well, certainly.